the truth about post-finasteride syndrome. In this video, I want to explain finasteride side effects. Okay, so I have seen a video from one medical doctor, and it made me a little bit upset because he was like, yeah, it's all in your head, and yeah, the possibility that you will have side effect from Propecia or finasteride is very, very low. Okay, so in this video I'll talk about type of side effects, how to reverse it. Okay, so uh, but what really I need to tell you. Okay, so it is told that most patients have zero side effect. Okay, so and most likely it is psychological. Okay, I strongly disagree because, like I said in other video, after seeing more than 200 clients, okay, seeing hundreds of blood work, you know, oat test, Dutch test, okay, you will definitely see before and after how finasteride have detrimental effect on these guys. Guys, I live with that for a few years too, okay? So I can tell you also from my own experience how it is, okay? It's definitely not a lie. In general, I see right now DHT epidemic also even in guys without taking finasteride and so on, because at the market at the moment are so many even natural supplements that can have such a detrimental effect on DHT and 5-alpha reductase enzyme. Okay, so uh, high dose omega-3. Okay, so if you eat a lot of PUFA, astaxanthin, you know, so black ginger. Okay, so many things. Even if you take pycnogenol in a wrong way, okay, so you will block 5-alpha reductase enzyme. Okay, so 5-alpha reductase needs H2O2 pulses. Okay, so it's not always about antioxidants and so on. Yeah, so yeah, many doctors will tell you there that you will also maybe experience something like testicular pain, maybe low depression, gyno, you know, so excess estradiol, maybe decrease in semen and so on, you know. So but what I see in guys I was working with, okay, so extremely watery semen, okay, so erectile issue even when using things like tadalafil, okay, so brain fog, neuroinflammation, because most of the doctor will tell you it is in your head. Yeah, it is in your head, and it's called neuroinflammation. Yeah, so the same I went through the same thing. Okay, so I have developed sleep apnea from that. Okay, so you really need to understand that it's not something. It's not something really easy for our system. Okay, so things like dry eye, muscle loss. Okay, so demusculization. Okay, so your face is not looking manly anymore. You are losing hair, face hair, and so on. Okay, so uh, for example, even when I work with guys on Accutane or previous history of Accutane, okay, so I see even after years that on the blood test that they have been using this, okay, so uh, don't try to convince yourself that if you will do nothing, the side effect will disappear. You need to be active, okay, so most of these things I would that are happening, I would really divide into a few categories. Okay, so neuroinflammation and neurosteroids. Okay, this is the one thing. Not every PFS guy has the same. Okay, so some have like neuroinflammation, neurosteroid issue. Okay, then some guys have 5-alpha, 5-beta imbalance. Okay, uh, some guys are having excess estrogen because, you know, so DHT is fighting for pathways with estradiol. Okay, so and you also should look at methylation support because it also can improve like gene expression. Okay, you really don't need specific medication, HDAC inhibitors and so on. Okay, so think about this. Okay, so you just need to do proper test. Okay, proper test, and based on that apply even natural things because they are working. Okay, so I have proof with more than 200 guys, okay? So let me know what you think and have a great day, guys. Bye.